Hello. Hi, my name is Torrin Stearns. I'm a fourth year medical student. It's a pleasure to meet you. Well, I'm a medical student, and my role as a medical student, is to be your advocate, is to be your partner, really, in helping you maintain your health, and be a resource for you to come to with any questions, concerns, or anything, even if they're remotely, about anything, even things that are related to health, like diet, exercise, quitting smoking, difficulty with transportation, finances, things like that. You can feel free to come to me with those sorts of questions. Your role as a patient is to help me help you. Your role is to be, open, honest, feel comfortable telling me about anything that's bothering you, be it whatever, be it anything. I'm here to help you, and okay. All right. So how today's visit's going to work? I'll chat with you for a while. We'll figure out what brings you in today, what's going on with you, see if there's anything else we'd like to discuss today. From a physical exam, and together we'll come with the plan that best suits you, gets you back on your feet. And then I'll step out, grab the attending. We'll discuss your case for a while, see if there's any loose ends that need to be tied up. The attending will come back in and we'll finalize our plan for the future, and then we'll set up a follow-up appointment. All right? Good. I'll just wash my hands. So, how are we doing? Tell me about yourself. Where are you from? Any kids? What do you like doing for fun? Did you go check out the art fair this past weekend? Gosh, yeah. I love it. All right. All right. Well, tell me what brings you in today. Oh gosh, that sounds painful. How have you been dealing with that? How does it affect? I mean, it sounds like it's really been bothering you. How's that been affecting your day-to-day life? Your family, work? Gosh, it must be difficult. Let's see if we can figure out and help you through this. What do you think's going on? Alright. Is there anything else you want to bring up today and discuss? Okay. Alright. Well, let's dive right in then about this. Start from the beginning. Walk me through and describe to me what happened. Can you describe to me the time course of the... Alright, are these discrete episodes? Did they both, or... Okay. Alright, can you describe the pain to me? On a scale of 1 to 10, 10 being the worst pain imaginable, where'd you put it? Anything make it better? Anything make it worse? How about changes in position? Rest? Okay. Alright, anything associated with it? Anything else you've noticed that came along with it? Anything else you noticed that's been bothering you lately? Alright. Okay, now I'm going to ask you a few questions that may seem unrelated, but they'll help me narrow down the diagnosis and figure out what's going on with you, okay? Alright. Lately, have you experienced any fevers, chills, night sweats, difficulty with sleep, unintentional weight loss, fatigue, headache? How about heart palpitations, heart skipping a beat, feeling your heart race, pain in your jaw, or down your arm? Alright, how about pain in your back? Sweating, difficulty catching your breath, nausea, vomiting, what a sour taste in your mouth, coughing up food, bringing food back up, heartburn. Have you experienced heartburn in the past? Have you taken Tums for that? Does this feel different than that? Okay, sounds like it. Okay. How about any cough, wheezing, any difficulty swallowing? Okay. All right. Well, so it sounds like, to summarize, it sounds like you've been having this pain going on for about 2 months. These 2 discrete episodes. Okay. All right. I'm going to ask you a little bit about your past, a little bit more to round this out and ask about your past medical history. Can you tell me what conditions you see the doctor for on a regular basis? Okay. All right, how long have you had these for? All right, any surgeries in the past? Okay. Have you been diagnosed with something? Hypertension, high blood pressure, high cholesterol, high lipids, diabetes, heart disease, heartburn or reflux, esophageal spasms, anything like that? Okay. Now, how about medications? Are you on any medications right now, over-the-counter meds, or prescribed, or herbs or supplements? Good. I really applaud you for knowing your dosages. Any allergies? Okay. How about, can you tell me a little bit about your family? Do you have any kids? Are you married? All right. Any siblings? Okay. All right. Now for your parents, siblings, or children, any medical conditions that run in your family? How about heart disease? Okay. All right. Nice. Okay. All right. Do you smoke? Have you ever smoked before? How many packs a day? Drink alcohol? Any problem, any alcohol dependency in the past? How about drug use? Any drug use now or in the past? All right. Can you talk to me about diet and exercise? All right. Okay. Have you struggled with your weight in the past? Okay. All right. Well, would you mind if I take a quick look at you? Okay. See your hands, feet. Just feel your carotid pulses right here. Just feel your chest. Line down for me. Turn your head over to the right. Turn your head over to the right. Take a deep breath and bear down. Okay. Good. All right. Staying right there. resting right there. You want to feel your chest. Just feel your heartbeat. Take a quick listen. Do you mind raising your left arm up over your head, rolling over on your left side? Perfect. Good. Alright. Any belly pain? Okay. Just come back up. Deep breath for me. Okay. Alright. Good, thank you. Well, alright, from the looks of things, the most likely diagnosis is something that we call angina. Heard of this before? Heard of this term before? Well, angina is where the heart doesn't receive enough blood flow, especially in times when the heart's working hard, such as exercising, or such as when you exert yourself, exercise, the heart beats fast. It's not receiving enough blood flow then, and therefore you get pain. It's a very similar process to a heart attack. The heart isn't receiving enough blood flow, but in angina, it only occurs. Your heart requires, your heart, it only lasts for a few minutes, and it only lasts for a few minutes. It doesn't lead to any heart muscle damage. Now this sounds like angina, but to be sure we need to run some diagnostic tests and studies in order to rule out some other things, like a heart attack, like gastroesophageal reflux disease, like esophageal spasm, or coronary artery spasm. So we'll need to run some tests in order to just make sure that this is what is going on. So typically, the next steps from here. Typically, the next steps from here would be to one get an EKG here today in the office. That's where we put stickers on your chest and take a look at the electrical activity of the heart. Second, we'll do a cardiac stress test that we'll have to schedule sometime this week or next week. That's where we'll have you on a treadmill or a stationary bike. Have you pump up your heart rate and take a look at your heart then when it's working hard. Third, I'd like to get some blood today just to check to see if we have any signs of heart attack, heart muscle damage, just to rule out, just in case to rule out heart attack. We definitely don't want to miss that. I know this sounds scary. I know it sounds really scary. That sounds really scary, but when it is. I don't want to minimize that. But I'm glad that you came to me with this, and together we'll help manage this. We'll help manage this and prevent this from turning into a heart attack. Okay, so those are the three diagnostic tests to do that we typically recommend. And for you at home, I'd recommend, in the meantime, until we get the results of these tests, I recommend continue a good, healthy lifestyle, diet, exercise. Continue to not smoke, drink alcohol. Don't stress yourself. Exercise, I recommend low to moderate intensity exercise. Don't overexert yourself to the point where you have this chest pain. It's still exercise. I recommend that once we have these the results back, probably within 2 weeks, we'll see you back then. And once we know that this is angina for sure, then we'll there'll be some other steps that we'll likely take potentially some more education and counseling regarding diet and exercise. Maybe starting aspirin, something like that. Okay, we'll get ahead of ourselves. Let's start here. How do you feel about this plan? How do you feel about this? Is there anything you'd like to change about this plan and the input? Do you think it's feasible? Do you think you can do it? Any problems? Financial problems, transportation? Alright. Any questions or concerns? I'm really glad that you came in today and together. I know that we can push through this, and I know we can push through this. All right. If you ever need anything, things get worse. If you ever need anything, things get worse. If you have any other questions or comments, this chest pain is worse or changes in character or anything like that, please give me a call right away. Be happy to talk to you. Okay? All right. Keith.